Hi friends, this is Dr. Chinmay Surve. I am a PhD in immunology and I am a scientist in Albert Einstein Institute, New York. Today I am going to talk about coronavirus 2.0 and answer some really important questions like should you wear a mask? Also give you some updates about the World Health Organization declaring coronavirus a pandemic. Story about virus mutating. The coronavirus has mutated. So let's start with a meme. Reiterating again, how does coronavirus spread? Coronavirus spreads through person to person when an infected person coughs or sneezes, and the cough and sneeze through droplets reach your eyes, ears, nose, or you inhale them, you get infected. You also get infected if you touch infected objects which happen to have infected person's cough or sneeze, and you touch in your eyes, nose, or mouth, you get infected. So the primary method of infection is through droplets from the infected person. So, should you wear a mask? I'll provide you both the good and the bad side. Let's get to the good side. Why you should wear a mask? Firstly, mask if worn properly and having the right quality can prevent the liquid droplets from entering your nose and mouth. Also, along with the mask, if you wear eye protective equipment, even glasses which prevent liquid droplets entering your eyes, you can prevent coronavirus infection. If you are sick, you can prevent coronavirus infecting other people around you. So you can prevent the spread of infection if you wear a mask. Similarly, the major cause of coronavirus spreading is because most of the infected person are non-symptomatic, and symptoms only occur later during the cycle of viral replication, which is determined to be 14 days. So for 14 days without any symptom, the infected person is spreading disease. So if you wear a mask in that case and you are non-symptomatic, you can again prevent the spread of disease. Mask also helps you to prevent yourself from touching your face, since one of the methods of getting infected is touching an infected surface and then touching your face, eyes, nose, and so on. Now let's go to the bad side, or why you should not wear a mask. Most people cannot wear a mask properly. That means you prevent any air from leaking from your mask outside. Masks, if not worn properly, can allow liquid droplets to enter your nose and mouth, and it really doesn't serve any purpose in that case. Second important thing is I work in a lab which uses masks and gloves frequently. We found out that because people have started hoarding up on masks and gloves, we as healthcare providers are unable to access the mask and gloves which we need on a daily basis. So if you really do not need a mask or you cannot wear a mask properly, please do not buy masks and allow us, as in the healthcare providers, the doctors, the scientists, the nurses, access to gloves and masks. The third reason why you should not wear a mask is if there's no need. If there is no known infection in your surrounding area or 100 miles from your surrounding area, there's no need for you to wear or buy a mask or gloves. And lastly, most of the masks you get in the market are disposable. That means you can only wear them for a few hours to a day. Some of them are washable and reusable, but they are few and far-fetched. So if you buy a mask, make sure you read the instructions properly as to how many hours you can wear them and after how many hours or days you can dispose them of. The reason for this is once you are wearing a mask, you are also breathing into the mask, which causes moisture retention in the mask, which leads to a lot of bacterial growth in the mask, which will lead to a different kind of infection. So if you're wearing a mask, it's very important to also know when to dispose of the mask. And if you do not know when and how to dispose of the mask, please do not wear a mask. I'll let you decide on what your condition is right now and if you should or should not wear a mask. I've shown you both the good side and the bad side of wearing a mask. You can certainly prevent spread of coronavirus by wearing a mask. Contrary to popular belief, mask can prevent the spread, especially in cases of asymptomatic coronavirus patients. So let's move on to the next update, WHO or the World Health Organization have updated their death rate from 2% to 3.4% of the infected patients. It's still very low, but it's a little higher than your normal flu. So coronavirus is not like your normal flu. I'll do a detailed comparison between coronavirus and your seasonal influenza flu in the next video. Also, the deaths are more than 6,000 now, or even more, with Italy getting infected, and the number of infections are way over 100,000 people. And WHO has also declared coronavirus COVID-19 as a pandemic. Pandemic means it has spread to most countries in the world. The bad news is coronavirus has mutated. So there are two forms of coronaviruses now, which takes us to the second part of the talk, which is coronavirus 2.0. So unfortunately, coronavirus is mutated. What does it mean? Mutation means from the original virus, there is a change in the nucleotide in the RNA of the virus. So what it does, it whatever diagnostics we have may not work in the new virus. So detecting the new coronavirus will be difficult. So what's the difference between the two forms? S form, the older form, from which there was a mutation in the RNA of the virus, leading to the formation of the L form. So S form, which was the original form, had 30% people were infected by that. This data is majorly from China, where the study is from. And it's the older virus, less aggressive, milder and less, and spreads slower. The new mutated form has infected about 70% of the population which were infected in China, and it's more aggressive and it's spreading more rapidly. The illness is worse, and the infections are steadily increasing. So this is a more aggressive form of the previous version. However, there are some good news and bad news. So if you see the rate of infection going on around the world, in Italy, in US, or in Germany, in Europe, as well as in some parts of Asia like Iran, looks like the virus is from the L form, which is more aggressive in spreading and has a worse illness rate. For example, if you see one man in New York who was infected pretty much more than 100 people in one gathering. So it looks like it's for all possibilities is that it's the newer form of the virus, which is the L form, which is infected. But don't worry, there is some good news. So let's go to the good news about this. Infection rate for the new mutated form are steadily declining in China. So the amount of people who are infected by this is steadily declining, and milder form will be predominant soon. So the original form will take over from the newer form, and the newer form hopefully will die down soon, and we may be reaching peak infection soon, especially in China, not in other parts of the world, but in China we are reaching peak infection soon. So now we'll see a steady decline in the number of people getting infected. The bad news is once a virus gets mutated, it makes it harder to keep track of it or treat it, because the diagnostic methodology is based on detecting the RNA and then sequencing it to see if it's the virus, the correct virus or not. If we do not have the correct sequence for detection, we may not be able to detect a virus, which leads to a lot of people getting released from the hospital even if they may be infected, and those people will then infect others. In US, we have seen this occur, and a lot of patients which were released, by example CDC has released one patient which then turned out to be coronavirus positive patient instead of what they previously determined was a negative one. So that's the bad news. The other bad news is even if you have been infected by one form of coronavirus, you can get reinfected by the other form. So that's one more bad news. So there are also many cases occurring where patients are getting reinfected by the coronavirus. So this is all the updates for now. Again, I want to stress the conclusion that coronavirus, though is highly infectious, it is important to avoid getting infected and prevent its spread. One methodology I mentioned is using a mask, use eye protective, always wash your hands, and stay away from sick people. Avoid travel to infected countries, and if you are infected, call a doctor immediately. Coronavirus is not deadly. It's only about 3.4% who die, with majority of deaths still in the elderly. However, the statistics is that it's changing a bit because of more aggressive form of the virus being dominant right now. But as per the data coming from China, the more aggressive form is on the decline in China, and we'll soon see that in Europe and the rest of the world. And coronavirus COVID-19 should not be feared. We should be cautious of its spread. We are the only ones who can prevent its spread by following all the strategies I just pointed out. With that, I would like to thank you for listening to my videos. Please do like, share, and subscribe. Your like, share, and subscribe is what motivates me to do more videos. With that, I would like to thank you. Bye.